everyone, welcome or welcome back to the channel, that is AMS MBBS lectures. In today's session, we're going to continue the same topic from CVS Microbiology, that is HIV and AIDS. This is the part 2 video of the same topic, guys. Okay, so in the previous part, we have covered up the first 3 topics, that is your introduction, structure of HIV and HIV genes and antigens. Right now, we're going to look into the details of the pathogenesis of HIV, guys. Okay. So over here, first of all, when it comes to pathogenesis, these are the subtopics or subheadings under which I will be describing this topic. First, we're going to look at the mode of transmission, okay, the various modes of transmission through which HIV is transmitted. The next, we're going to look at the receptors, okay, at which HIV is going to bind, and then it is going to enter inside the host cell. So a bit knowledge about the receptors, that is what is the main receptor, what is the co-receptor, and some related points like the mutation in the receptor, that is the delta 32 mutation, and also the details of the DC sign receptor. Okay, then how it is replicating inside the host cell. Once it has attached to the receptor, it has gained entry inside the host cell, then how it is going to replicate, that whole flowchart ke form mein I will be explaining you under replication. Then we're going to look at the disease progression and the natural course of the disease. Okay, disease progression. Okay, there are different types of disease progression. Okay, in different individuals. So we're going to have a look in that thing. And then we are having the natural course of the HIV infection. Okay, here I will be explaining you. As I already said you that HIV is an infection which occurs in stages. So what are those stages? That I'm going to describe under the natural course of HIV infection. Okay, let's move on towards the first topic, that is your mode of transmission. So there are various modes, of which the first one is the sexual mode of transmission. When I say sexual mode of transmission, this is considered to be the most common mode of transmission, and you have to remember that nearly 75% cases of HIV are due to sexual mode of transmission, guys. In sexual mode also, the most common route of transmission, okay, the most commonest route of transmission is via the heterosexual route. Okay, heterosexual route, that is from male to female via vaginal intercourse. Okay, now one thing, that is what about the risk of transmission. Okay, when I talk about risk of transmission, and that to the sexual mode of transmission, the risk of transmission is minimal, guys. It is the least, it is minimal, that is nearly 0.1 to 1% is the risk of transmission per coitus. Okay, and also one thing that you have to remember, that the risk of transmission is a bit higher in anal intercourse as compared to the vaginal intercourse, guys. Okay, as compared to the vaginal intercourse. This was about the sexual mode. The second mode that we are going to describe over here is via blood transfusion, and blood transfusion is considered to be as the least common mode of transmission, and that is nearly 5% of cases, okay, of HIV are because of blood transfusion, and the risk of transmission is maximum over here. The risk of transmission is maximum with the blood transfusion route. It is maximum, guys. How much? That is nearly 90 to 95% cases may, okay, the 90 to 95% is the risk of transmission via blood transfusion, guys. Okay, next thing, that is the percutaneous mode or mucosal mode of transmission. Okay, kaise hota hai? Simple. Okay, if a person is getting a needle stick injury or basically injection drug abuse, okay, IV drug abuse, sharing of razors or tattooing or splashes of infected blood on the eyes, these are the various ways through which HIV is getting transmitted via the percutaneous or the mucosal route. Okay, again, this is not very common mode of transmission, guys. Okay, and another one that is called as your perinatal mode of transmission. When I say perinatal mode of transmission, guys, please remember that is without any intervention and all over here. The risk of transmission, again, via the perinatal node is nearly 20 to 40% without any what you can say intervention. The risk of transmission via the perinatal mode is nearly 20 to 40%. Okay, and please remember, देखो transmission can occur. Perinatal mode का मतलब क्या होता है? That is the transmission that is occurring from the maternal end. Okay, maternal end to the fetus, guys. Okay, maternal to the fetus. This is what is called perinatal mode of transmission, from the mother to the fetus. Simple. Now, during the whole pregnancy, guys, the transmission can occur any time. Okay, pregnancy के वक्त हो सकता है, post pregnancy during breastfeeding वाले phase में, any time. But the risk of transmission is maximum during at the time of delivery, or you can remember that is when the mother herself has got a recent infection, guys. Okay, so we can write that the mother is recently infected. The mother is recently infected, or she is already a known case of HIV, already having HIV, already having not HIV, you can say already having AIDS. So mother is recently infected with HIV, or she is already having AIDS, guys, or at the time of delivery. These are all the conditions where the risk of transmission is maximum under perinatal mode of transmission. Make sense? Okay. Next thing. Now we have discussed over here the various modes of transmission through which HIV can be transmitted. Now there are certain modes through which HIV is not transmitted, and those includes casual contact. Okay. So casual contact with any HIV infected person, or kissing, you can remember, or via an insect bite. See, these are the mode of transmission through which HIV can never be transmitted, guys. Okay. Next thing, we have to remember the viral load, yani ki the amount of virus present in different secretions or different body fluids. Okay. So the viral load is considered to be maximum in the blood, genital secretions, and your CSF, okay, or CSF. So these are the body fluids, okay, where the viral load, HIV viral load is maximum. Then HIV viral load is variable, okay. If I say it is variable, so it is going to be variable in breast milk and saliva, okay. So breast milk and saliva is the secretions where, or the body fluids where viral load is considered to be variable. And the viral load, if I say, it is like 0 to minimum, okay, 0 se lekar ke minimum viral load means it is in your other body fluids, okay, or we can say urine, okay. So in the remaining body fluids, the viral load is considered to be 0 or minimal, or you can say, and that may also include your urine. Urine can be viral load is very low, okay. Now pay attention to one thing. I am saying that HIV is not transmitted via kissing, okay? And I am saying that the viral load is variable in saliva. I mean saliva के अंदर viral, the HIV virus present है, but the amount is very variable over here. But still, kissing के through, यानी कि whenever a person is coming in contact with the saliva of an infected person, HIV is not getting transmitted. Why is the question? Because saliva is having some inhibitory substances, and those inhibitory substances are your fibronectin, that you have to remember. We have fibronectin, and also it is having some glycoproteins, okay. Also it is having some glycoproteins. Because of the presence of these inhibitory molecules, saliva is going to prevent the transmission of HIV, okay. It is going to prevent transmission of HIV. Clear यहाँ तक? ठीक है. So that was all about the mode of transmission with respect to HIV. Okay. Now we're going to have a look on the receptor attachment over here, guys. Okay. Now for the HIV virus to enter inside the target cell, guys. Okay. For the HIV to enter inside to the host cell, it is the, देखो HIV के structure में, let you all know, envelope पे we all are having the glycoproteins, yes or no? So this glycoprotein 120 that is shown over here, these structure that I'm highlighting over here, these structure are going to bind to two receptors within the host cell. Okay, the first receptor that is called as the main receptor, which is nothing but your CD4 receptor, guys. Okay, the main receptor over here is the CD4 receptor, which is mainly present on the helper T cell. Apart from this thing, the CD4 receptors are also present on structures like your monocytes, macrophages, Langerhans cells, astrocytes, keratinocytes, and the glial cells. Okay? And then please remember, not just binding to the main receptor, it will gain entry inside. For it to gain entry inside the host cell, the GP120 that is present on the envelope of the HIV virus has to bind to a second co-receptor, and which is nothing but the chemokine receptors present in the host cell, guys. Okay? And the examples of chemokine receptors are your CXCR4 receptor, which is present onto your T lymphocyte, and you also have a CCR5 molecule which is present on the macrophages. Okay, so please remember, it is the glycoprotein 120 of the HIV virus which is coming in contact with the two host cell receptors, that is the CD4 receptor, which is the main receptor, and the chemokine receptors, which is the second co-receptor. And then after attaching, guys, it is gaining an entry inside the host cell. Okay. Now, one additional point with respect to the receptors is that it is about this CCR5. Okay, na? So as I said, it is compulsory for the GP120 to bind to both the receptors, then only HIV can enter inside the host cell. Now, what if I am saying that this CCR5 molecule, this chemokine receptor undergoes a mutation? Okay, please remember, this mutation is very important, and this is something that's very rare. Mutation taking place in the CCR5 molecule, which is present on the macrophages, guys. Okay, this is also called as the delta 32 mutation. Very important mutation, guys. Again, this thing is something that is seen only in Europe and Western Asia. Okay? Very few people, again I'm repeating, very few people will have this mutation into this thing. अब मेरे को बताओ, अगर ये CCR5 receptor में mutation हो गया, so will the HIV get an entry inside the host cell? The answer is absolutely no. Right? So there is blockade of the HIV entry into the host cell. HIV cannot enter inside. मतलब the individual जिसके अंदर ये mutation present है, he becomes resistant to HIV infection. The answer is yes. But you have to remember that this mutation, अगर वो homozygous है, if the individual is having a mutation in the CCR5 and is and the patient is homozygous for that mutation, then it is having complete resistance to HIV infection. And if the person is heterozygous for this thing, so see, the patient is susceptible to HIV infection, but HIV ka infection progressing to AIDS becomes very delayed over here. I hope the concept or the details regarding the receptor is also clear. Now, one more point regarding receptor is left, and that is what is called as your DC sign. What is this DC sign receptor? ये receptor हम लोग के dendritic cells में present होता है, and this is a kind of a specific lectin receptor. So dendritic cell specific lectin receptor होता है. Where this receptor is present? On the skin and the mucosal surfaces पे present होता है. ठीक है. Now over here, this receptor पे HIV1, specifically if I say it is the HIV1, that can bind to the DC sign receptor के साथ HIV bind करेगा. The only thing I am saying, it is only binding. From binding with the HIV, okay, see, HIV binding with the DC sign receptor is not going to mediate the cell entry to the virus. यानी कि HIV DC sign receptors के साथ bind करके it cannot enter inside the host cell. Instead, this particular receptor will help in the transport of the HIV. It helps in the transport of the HIV. So, if I am saying that is via the skin or the mucus, if the person is getting an HIV के साथ, if the person is getting in contact with HIV via skin or the mucosal surface, it is the DC sign receptors which is going to transport the HIV from the skin via the dendritic cells to the lymphoid organs, guys. And it is the lymphoid organs where the HIV is going to multiplicate and gain entry into the body, guys. Okay? And it will result into the disease. So concept of DC sign is also clear. It is just a receptor, okay, dendritic cell receptor. It's a lectin receptor जो हम लोग के skin and mucosal surfaces पे present होता है. Only it will help in binding and transportation. It is not going to mediate cell entry for HIV. Clear? So that was all about the receptors. Now let's have a look on the replication, that how the virus is getting replicated over here, guys. Okay? Okay. So over here, first of all, I let you all know that is for the HIV virus to gain entry inside the cell, it has to attach to the receptors. Yes or no? So GP120 is going to bind to the CD4 receptor, which is the main receptor, and it is also going to bind to the chemokine receptor, which is the co-receptor. So दोनों receptor के साथ bind किया. After attaching, guys, the fusion of the HIV with the host cell is brought about by the second glycoprotein which is present on the virus के envelope पे जो present होता है दूसरा glycoprotein, that is glycoprotein 41, and which is acting as the fusion protein, which is the fusion protein will cause fusion. So attachment to the receptor is done, fusion is also done. Now what will happen, guys? Okay, pay attention over here on the image. It is this structure that I'm highlighting. What is this? It is the nucleocapsid. So after attaching and fusion, guys, it is the nucleocapsid that is going to enter inside the host cell. So nucleocapsid is going to enter into the host cell cytoplasm, and what is inside the nucleocapsid? RNA, single stranded RNA के दो copies, and you all are having your viral enzymes like the reverse transcriptase and the integrase. So please remember that is your nucleocapsid entering inside the host cell, and it will release the single stranded RNA and the viral enzymes को वहाँ पे release करेगा वो. ठीक है? We'll come back to this slide. Let's go towards the next slide, that is this thing. तो अभी मैंने क्या बोला कि सेल होस्ट सेल के साइटोप्लाज्म में वी आर हैविंग द वायरल आरएनए प्रेजेंट, राइट? नाउ फॉर द वायरल आरएनए टू इंटीग्रेट इनटू द होस्ट डीएनए, है ना, आरएनए डीएनए के साथ इंटीग्रेट हो सकता है क्या? नो. एंड दैट इज व्हाई वायरल आरएनए को फर्स्ट द वायरल आरएनए हैज टू गेट कन्वर्टेड टू अ डबल स्ट्रैंडेड डीएनए, एंड देन दिस डबल स्ट्रैंडेड डीएनए कैन इजीली गेट इंटीग्रेटेड इनटू द होस्ट सेल डीएनए. Make sense? So let's have a look on the conversion over here first of all. तो single stranded RNA पे काम करने वाली हम लोग की reverse transcriptase enzyme, and it will generate a strand of DNA. So you are getting RNA है and RNA से एक DNA बना, that thing is called as a DNA RNA hybrid. So what is the activity the reverse transcriptase enzyme is showing over here? RNA के basis पे it is producing a DNA over here. Therefore we say it is an RNA dependent DNA polymerase activity of the reverse transcriptase enzyme. Okay, now we get a DNA RNA hybrid. Do you require the RNA? No, we don't require RNA now. We want only DNA. Yes or no? So now this RNA is getting degraded via the ribonuclease activity of the transcriptase enzyme. Reverse transcriptase enzyme की ribonuclease activity होगी, and this strand of this DNA gets digested. Okay, RNA की strand digest होगी, not DNA. RNA का strand digest हो जाएगा, and you will be getting a single stranded DNA over here. Clear? Now this single stranded DNA will generate another strand of double stranded DNA. Again, this whole process is mediated by the reverse transcriptase enzyme, but now DNA से DNA बन रहा है, तो now it is called as a DNA dependent DNA polymerase activity of the reverse transcriptase enzyme. Finally you get a double stranded DNA. Okay, now please wait over here. Now once this double stranded DNA is formed, it will undergo transcription. Okay, it undergoes something called as transcription to produce some viral components. Okay, it will produce a few viral components, and those are nothing but your GAG matrix protein. Then it is also going to produce the accessory VPR protein, okay, and the viral enzyme, that is your integrase. Okay, it is also going to produce integrase. So all these structures along with the double stranded DNA is referred to as the pre-integration complex. It is called as the pre-integration complex, something that is formed before integration is going to take place, and it is this pre-integration complex which is then transported to the host cell nucleus. Okay, now after entering inside the host cell nucleus के अंदर enter करने के बाद, this double stranded DNA is going to get fused with the host cell DNA. तो viral DNA host cell DNA का integration होगा. Process is mediated by the enzyme viral integrase, and after integration जो चीज बनती है, this thing over here that you are seeing is now referred to as a provirus. Okay, it is referred to as the provirus, and this provirus can result, okay, it can establish a latent infection. It will result into a latent infection. Okay, and plus remember latency तो produce किया है, it will generate, it may establish a latent infection, but it will also continue to replicate. Okay, will also continue to replicate, यानी कि ये जो आप लोग का प्रो वायरस है, that will undergo transcription and translation using the host cell का polymerase enzymes को use करके will undergo transcription translation. It is going to produce the viral proteins, it will produce the viral single stranded RNA. All of this thing will assemble together and it will result into the formation of these viral, okay, daughter virions के अंदर बन जाएगा ये. Okay, this was the story. Going back to the flowchart, and let's continue the flowchart again over here. So as I said, that is attachment fusion हुआ पहले, ठीक है. Then the nucleocapsid enters inside. It will release the single stranded RNA and the viral enzymes. Now the single stranded RNA within the host cell के cytoplasm में, it will get converted to a double stranded DNA via the action of the reverse transcriptase enzyme. है ना, ये चीज मालूम पड़ी. What is the detail? We just had a look on the previous slide. Now once the double stranded DNA is formed, this double stranded DNA will undergo transcription and it will produce some viral components, that is the GAG matrix protein, the accessory VPR protein, and the viral integrase enzyme. So these all structures along with the viral DNA is what is referred to as the pre-integration complex. Okay? And this pre-integration complex is then transported to the nucleus. After entering into the nucleus, viral DNA and host chromosome के अंदर integration होगा. पूरा process होता है via the enzyme integrase, and now the structure after integration is called as the provirus. Provirus can result into a latent infection, and which is for a variable period. And then this whole provirus, definitely yaad rakhna, please remember this important point, that is HIV during the latency period also it will continue to replicate. वही लिखा हुआ है, it can replicate even during the latency period, unlike the other latent viruses. Okay, and by when I say it is replicating, यानी कि it will continue to undergo translation करवाएगा, and it will result in the production of your daughter virions. Makes sense? I hope the whole pathogenesis over here is clear. Okay. Next topic that we're going to discuss is disease progression, which means that if an individual is infected with HIV, guys, so disease is going to progress differently in different individuals. Okay? So in majority of PLHA stands for people living with HIV or AIDS, guys. So majority of the cases, that is nearly 80 to 90% of the people, are typical progressors. Okay? Which means that in these individuals, the HIV infection will develop into AIDS within a span of 10 years. Okay? Second category is something that is called as your rapid progressors. Okay, the second category is of your rapid progressors. Okay, in which, okay, in these individuals, okay, we are having the disease is going to progress towards AIDS within a span of 2 to 3 years, and only 5 to 10% people will be belonging to the category of rapid progressors. Okay. Then the third type of disease progression is long-term non-progressors. From the name itself, it's very clear that is long-term. That is, the disease is going to take a lot of time for it to develop into AIDS. That is, okay, a span of 10 to 30 years it will take, and that too the patient is not on ART. Without ART, okay, it will take 10 to 30 years for the HIV infection to develop into AIDS, guys. And in such individuals, the HIV RNA copies का जो count होता है, that is less than 5,000 HIV RNA copies per ml, and this category usually belongs to the CCR5 mutation के साथ एक association होता है. Now I hope you know what is CCR5 mutation, the delta 32 mutation that takes place in the co-receptor of host cell, है ना. So again, as I said, that this mutation itself is very rare. Okay, it happens in very few people, and therefore this LTNP category of disease progression is also seen in 5% of cases. Now less than 1%, very few people would be belonging to the category of elite controllers, or which is basically a subset or subtype of long-term non-progressors का subtype माना जाता है. इसमें भी same चीज है, that the HIV infection is going to take a very long time, and that too without ART, that is nearly 10 to 30 years it will take for it to develop into AIDS. And also, guys, यहाँ पे जो RNA detection if you are going to perform, the viral RNA detection if you are going to perform, so it is like the levels are so low, that is less than 50 RNA copies per ml, that it is falling below the detectable level. Okay, so this was all about the different types of disease progression that I wanted to explain. Okay. Now, of this all types, as I said, that the typical progressors are the common type, right? सबसे ज़्यादा 80 to 90% cases typical progressors के होते हैं. So on the next slide, we are going to look at something called as the natural course of HIV infection. And this course, okay, means the stages, or you can say the phases through which HIV infection will progress in order to develop or reach towards AIDS is what is called as the course of HIV infection. And these phases of the HIV infection are with respect to the typical progressors. So this course is with respect to the typical progressors. These are the stages through which HIV infection is going to progress and ultimately end up into AIDS, guys. First stage is the acute HIV disease, also called as acute retroviral syndrome. Second stage, okay, followed by this first stage, there is an asymptomatic stage, also called as the stage of clinical latency. Then there would be personalized generalized lymphadenopathy. Then the fourth stage, where the person may develop symptoms, where the person starts developing symptoms, is called symptomatic HIV infection. Okay, it's also called as AIDS-related complex, and ultimately, if not treated, the patient will ultimately land up into the last stage, the advanced end stage of HIV infection, and that is called as your AIDS. Okay, so these are the stages. Okay, now please note over here this thing, that is the details of each and every stages. I will be posting a separate video regarding the details of all these stages. Okay, what are the characteristic features of each and every stage, that is going to be discussed in a separate video, not over here, because already the नहीं तो फिर video का length बहुत ज़्यादा बढ़ जाएगा ना, the video's length will increase a lot. So right now I'm just keeping it only till the name. The details would be covered in a separate video. Let's proceed ahead. Let's have a look on the next thing, that is clinical diagnosis. So we are done with the pathogenesis of HIV and AIDS. Right now we are moving on towards clinical diagnosis. What is the importance of this? What do you mean by clinical diagnosis, guys? What is the importance? Okay, so clinically, when the patient is coming in towards you, and if by just looking at the symptoms the patient is coming with, by the associated conditions the patient is coming with, we can make a diagnosis, and that is what is clinical diagnosis. And what is the use of doing this thing? It is going to help you in tracking and monitoring the HIV epidemic. And also this clinical diagnosis or staging is going to help you, it is going to provide you information regarding the disease stage, okay, as well as the clinical management of the disease, guys. And it is useful for both the clinician as well as the patient, guys. For clinical diagnosis, we have two important classification systems. We have two classification systems, and that is your CDC classification system, and we have the WHO clinical staging of HIV and AIDS. Okay, so CDC classification system came into picture in the year 1993, and according to this classification, it divides your HIV infections into total of 9 stages में divide करता है, ठीक है? And what is the basis of this classification? So it is based on the associated clinical conditions, associated clinical conditions, as well as it is based on the CD4 T cell count plus the CD4 T cell count पे based होती है ये वाली, ठीक है? On the other hand, the WHO clinical staging came into picture since the year 2007 में ये guidelines दी गई थी, ठीक है? It is going to divide your HIV infection into 4 stages. Okay, it will divide the HIV infection into 4 stages, and this is based on only on the, it is based only on the associated clinical conditions. Associated clinical conditions. Over here, we are not involving the CD4 T cell count. Okay, so when it comes to resource poor countries, including India, where the facilities for assessing or estimating the CD4 T cell count are not available, in those situations or places, your WHO's clinical staging comes very handy, guys, for doing the clinical diagnosis of HIV or AIDS. Okay, so this is okay. So WHO something is what we follow in India. This clinical staging of HIV and AIDS is followed in India, guys. Okay, so let's have a look on the details of clinical WHO's clinical staging. As I said, there are total 4 stages. So same thing written over here. There are total 4 stages of HIV. And what is the basis of this staging? It is based on the associated clinical conditions the patient is going to present towards you. So if the patient is okay asymptomatic है, patient is having personalized generalized lymphadenopathy, अगर ये दो conditions होती है, तो definitely the patient is belonging to the stage 1 category. Okay. Now when it comes to clinical stage 2, clinical stage 3 and clinical stage 4, one thing is common, and that is called as weight loss. In stage 2, there is moderate weight loss. Okay. In stage 3, there is severe weight loss, and in stage 4, there would be something called as a profound weight loss. In clinical stage number 2, guys, in stage 2, guys, along with the moderate weight loss, there would be the patient may complain of respiratory tract infections like sinusitis, tonsillitis, otitis media, pharyngitis. Okay, then condition like your herpes zoster, angular cheilitis, recurrent oral ulcers, papillopruritic lesions, seborrheic dermatitis, and fungal nail infections भी हो सकती है. So if this is what the patient is coming towards you, you say this is the patient is belonging to clinical stage 2. Clinical stage 3 के अंदर, in stage number 3, what is there? ठीक है, first of all, as I said, there is something called as a severe weight loss है, of more than 10%. Along with the weight loss, the patient will be presenting with chronic diarrhea for more than 1 month. The patient will also have persistent fever for 1 month. Along with that, patient may present with oral candidiasis, oral hairy leukoplakia. Okay, so can you just pay attention? In stage 3, you are having mainly you are having something called as oral condition like oral candidiasis, oral leukoplakia. Okay, then there will also be something called as your acute necrotizing ulcerative stomatitis, gingivitis, periodontitis. तो all these oral conditions present है हम लोग के साथ. ठीक है. Along with that, some respiratory condition like pulmonary tuberculosis, some severe bacterial infection like pneumonia, empyemas, and unexplained, okay, hematological problems like anemia, neutropenias, or chronic thrombocytopenia, some hematological problems के साथ भी आ रहा है patient. So that is something that means the patient is belonging to clinical stage 3. Now in stage 4 also, जैसे कि stage 3 की जो पहली 3 criterias है, ठीक है, वो that same thing is also present in clinical stage 4. The only difference is here the weight loss is going to be profound. The patient having a profound weight loss with again chronic diarrhea means a diarrhea which is persisting for more than 1 month and and then the patient is also having a prolonged unexplained fever for 1 month. All these three things together when it comes to stage 4 guys, stage 4 के अंदर ये तीनों चीजें जो हमने stage 3 में भी देखी थी उसी चीज को यहाँ पे it is referred to as an HIV wasting syndrome, also called as your slim disease. HIV wasting syndrome or slim disease. ठीक है, तो ये चीज तो है. ठीक है, first these three things would be present in your stage 4. Along with that, stage 4 is characterized by the presence of your opportunistic infections. Okay, bacterial opportunistic infections like your recurrent severe bacterial infections, pulmonary tuberculosis, extrapulmonary tuberculosis, and a mycobacterial infections. Those are all your bacterial opportunistic infections. Viral opportunistic infections like your HSV ka infection ho gaya, CMV infection you can remember over here. Then we are having some fungal opportunistic infection like pneumocystis jirovecii resulting into pneumonia, esophageal candidiasis. And these are fungal opportunistic infections. Now, parasitic fungal opportunistic infection includes toxoplasma encephalitis. Then it is also having chronic intestinal cystoisosporiasis for more than 1 month, atypical disseminated leishmaniasis. So these are multiple opportunistic infections. So along with your HIV wasting syndrome, if the patient is presenting with opportunistic infections and the patient may also present with some neoplastic conditions, okay, Kaposi sarcoma, invasive cervical cancers, or your lymphomas, so we can say it is again stage 4, and it can also have some directly, okay, so that is called direct HIV induced conditions like HIV encephalopathy and your symptomatic HIV associated nephropathy or cardiomyopathy का association भी होगा. So in short, if I say you in stage 4, you all are having the triad of the weight loss, chronic diarrhea and unexplained fever. तो वो जो तीन चीज है वो चीज तो present है. तो you all are having the slim disease. If the patient is having slim disease, patient is presenting with opportunistic infections, and also the patient is having a neoplastic condition. A neoplastic condition hai. Also the patient may have an HIV induced, okay, direct HIV induced conditions like encephalopathy, and also have your nephropathies and cardiomyopathy agar hai. So any of these disorders are present. See, I am not saying कि सारी की सारी चीजें present होगी. Any of the combination, it simply indicates the patient is belonging to the clinical stage number 4. Okay, so this is not a very important topic with respect to exams. Okay, so far it has never been asked in the exams to write about this thing. But in case if you are getting this thing, they will ask you. But one thing from this thing that you have to remember is whenever a question is there on HIV into your theory papers, okay, or maybe into your vivas also, there are likely chances that they are going to ask you on a question regarding the opportunistic infection seen in case of HIV infection. So you should be knowing this bacterial, viral, fungal and parasitic infections, parasitic opportunistic infection seen in case of HIV. And remember 2 to 3 names with respect to this thing. Again, in the upcoming slide, I will be letting you all know some important or the most commonly associated opportunistic infections seen in HIV and AIDS. Okay. So that was all with respect to clinical diagnosis, guys. Okay. Now, next we are going to look at some additional points with respect to HIV and AIDS. Okay. When is World AIDS Day celebrated or observed? So every year it is the 1st of December. It is observed as World AIDS Day, guys. Okay. Then let's have a look on the risk categorization. So which people belong to extremely high risk group and which individuals are belonging to your moderately high risk group. So when I talk about your under extremely high risk group, we have female sex workers. Then it is also involving men who have sex with men. So men. who have sex with men. Okay. Then we also have transgender people. They are also very at extremely high risk group category में belong करते हैं. Then your IV drug abusers, IV drug abusers. And these are all the individuals which are belonging to the extremely high risk group. Moderately high risk group means people belonging over here are your health care workers. ठीक है. Because of needle prick injuries or splash injuries के वजह से healthcare workers are also and the belonging to the moderate high risk group. Then individuals who are having some hematological disorders, okay, like your hemophiliacs, and other blood recipient people, okay, and other blood product recipients, okay, and other blood product recipients. These are also belonging to this category. Then we all are having your people with STIs, okay, and then people who all are having STI. So people having STI, syphilis, gonorrhea, and again to the moderately high risk group for HIV or AIDS. Next, some extra point over here. Yes, this is also very important. That is with respect to opportunistic infections. Okay, so the most common, okay, globally, if you have a look, the most common opportunistic infection seen in with case of HIV or AIDS is your bacterial infection, and that is your tuberculosis. Okay, please never forget tuberculosis is the bacterial opportunistic infection, which is the most common global opportunistic infection associated with HIV or AIDS. Then common fungal infections की जब मैं बात करूंगा तो we all are having conditions like your candidiasis है ना, candidiasis specifically if I write there would be patient would be having oral thrush, ठीक है, and the patient may also have something called as your pneumocystis jirovecii infection. Okay, so pneumocystis jirovecii resulting into pneumonia. So these are some common fungal opportunistic infections to remember. Frequent viral infections that take place are what? We all are having your herpes simplex, okay, herpes simplex, mucosal lesions, another infection by the herpes simplex virus resulting into some mucosal lesions, and we also have your cytomegalovirus, okay, cytomegalovirus affecting the retina resulting into cytomegalovirus retinitis. Okay, so this is also the frequent viral opportunistic infections. And common parasitic infections, pay attention to the parasitic infections. We all are having your toxoplasma encephalitis, toxoplasma encephalitis. Okay, so parasitic infection involving the brain, okay, involving your brain. Then we all are having your cryptosporidium parvum diarrhea, cryptosporidium parvum diarrhea. And lastly, we have the example of your strongyloids, stercoralis, hyperinfection syndrome. It's a big name to remember. That is strongyloids, stercoralis, hyperinfection syndrome. Okay, so that was all with respect to the opportunistic infections under HIV and AIDS. Okay, it's again very important to remember a few names under each category with respect to opportunistic infections. It can be asked both into your theory as well as your viva. Okay. Next, we're going to have a look on some organizations with respect to AIDS, guys. Okay? So we have two organizations. So globally, if I talk about, so globally we have the Organization for AIDS, that is your UNAIDS, okay? And that is a joint United Nations program on HIV or AIDS. And it is this organization which put forth the fast track strategy to end the AIDS epidemic by 2030. This strategy was put forth by UNAIDS, guys. Okay? Then we have, with respect to India, we have NACO, that is your National AIDS Control Organization. It is the India's voice against AIDS. Okay, so just names of two organizations you should be knowing. So we have covered up the pathogenesis along with the clinical diagnosis of HIV and AIDS, and we also had a look on some additional points with respect to HIV and AIDS, guys. Okay, so that is it for this session. This marks the end of this topic, guys. So thank you so much for watching. If you found this content useful, then do like, share, and subscribe to the channel. And if you have any questions or queries, then do comment down. I'm there to answer it. Bye bye.